Well, I think it's a combination of a couple things. The FDA can certainly put public pressure on these because right now, as Scott Gottlieb mentions in the past, we have an epidemic of these types of e-cigarettes and nicotine use in teenagers, and that's a huge concerning thing. But also they have the power of the law behind them because the law recently changed to let them regulate these e-cigarettes, these nicotine delivery devices as they call them. And so right now they're looking at these, it's basically the who's who of retailers. You have corner convenience stores, you have some of the biggest pharmacies out there, and the Walgreens in particular, they're looking at and they want to talk to because they had a violation of 22% on the ones they inspected, meaning that when they went in there, they were selling these products to teenagers at that rate of 22%. And so that's something that's very, very concerning, especially from a health perspective.
Yeah, and this was not just the e-cigarettes that he was driving at here, as I understand it, but it was also tobacco products, where I believe in most jurisdictions, it's forbidden to sell to people under the age of 18, some cases maybe even 21. Let's move on to another story that is really alarming, and that is a very sharp rise. More than 150,000 Americans died from alcohol, drug-induced causes, and suicide in 2017. That's more than twice as many as in 1999. It would seem that the three, alcohol-related, drug-related, and suicide, are part of a similar picture.
They are part of a similar picture, and like you said, they've doubled, more than doubled since 1999 to 2017, but the big driver behind that are the drug deaths that are coming about because of opioid deaths from either prescription or or non-prescription. They get off the street, synthetic opioids. The example I can give you is 2 decades ago, we're talking in the 90s, fentanyl and synthetic opioids accounted for 1,000 deaths a year. That's 2 decades ago. Fast forward to 2017, and now it's 1,000 deaths every 2 weeks. That's how prevalent these have become, and that's how dangerous they've become. But on top of that, we have the alcohol-related deaths, and we have the overall suicides as well. And so the big concern here is a couple things. One, what we seem to be doing isn't working as well as a lot of people would like, myself included. And so there's something else that needs to be done. And what some experts are saying is we need more systemic changes across the country, and hopefully that helps out.